Live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we teach you how to live a longer and healthier life. I'm Lorena Anderson, your life and energy coach, and also your host for this evening. You can find us here every Tuesday between the hours of 6 and 7. And we're also on 1470 AM and 95.3 FM. We are streaming live on Facebook for All County Healthcare, and you can also find us on www.nnradio.com. Just look for You and Your Doctor. So, welcome. It's great to have you here this evening. We've got a couple great guests. By the way, this is being presented by AMP2 TV. We're streaming live on that as well. And you can also find us on www.radio.com. And we are being proudly sponsored by All County Healthcare, where patients are the heart of their business. And I just want to give a shout out because they provide this show for all of us so that we may be more informed about what is out there, how we can help ourselves or our loved ones, especially when it comes to things of a medical nature. All County Healthcare, if there's any questions that you might have, you can always give them a call at 888-717-7170. Just ask for Maddie. She can help you with any of your after-hospital health care needs. And also, if there's any questions that you might have for any of the doctors that we have on our show, give her a call. She'd be more than happy to put you in touch with them. So without any further ado, I'd like to welcome our first guest. And this is Dr. Michael Krantzow.
Yeah.
And
exactly.
It is a pleasure to have you.
Thanks for having me.
Orthopedic surgeon. And he's going to talk to us about some of the situations that he deals with in his practice. But first of all, before we do that, tell me what made you decide to go into this particular specialty?
So I chose orthopedics back in medical school because I like fixing people. I like making people better. I like them coming in to see me, and when they're done with me, they actually feel better. I don't just write them a prescription or listen to their heart, which is a very important thing to do. But I can actually go from having a broken bone or having a fracture or having arthritis to having a new fixed problem that they can live their life with.
That is wonderful. That is wonderful. So where did you do your studying?
Sure. Well, lots of studying.
Lots of studying,
I started in college in Boston, and then I did medical school in Kansas City.
Oh, wow. Okay.
And then I did my residency and fellowship training at North Shore Long Island Jewish Hospital in New York City, and fellowship at Lenox Hill Hospital in Sports Medicine in New York City.
Oh, okay. Wow, you've got quite a list there.
It kept me busy for a little while.
I would say. How long have you been down here in Florida?
Just a little less than a year.
Okay.
Yeah.
What brought you down?
We wanted to enjoy the Florida lifestyle, to work hard and enjoy our family.
I totally agree. I'm from Chicago. Now I can only go back for a very short period of time.
Not during the winter.
I became cold traumatized. So,
I get it.
I can go up there for, 4 days at the max, as long as I know I'm coming back home.
I get it.
Yeah. Well, welcome. It's great to have you.
Thank you.
Where do you practice? Where's your practice located?
Well, we have two offices. The first one's in West Boca, on the campus of West Boca Medical Center.
Okay.
It's 9970 Central Park Boulevard. And then we also have a second office in Delray Beach, and that's on Jog Road, just north of Lake Ida. So
okay.
that's we try to make it two pretty convenient offices, and patients can see us at either office. I'm at both offices multiple times during the week.
I was going to say, oh my goodness, a lot of drive time in between, huh?
Yeah, back and forth. But it's convenient for the patient, so that's why we do it.
Oh, well, that's sweet. Well, you know something, that's one of the other things that I want to commend all county healthcare. We get some of the greatest doctors. The majority of our doctors have got such great bedside manners. They're so compassionate. They listen, and that's the key here, to be able to listen to what is happening, but they're also connected emotionally. And that is so important for the patient.
Yeah, that's the art of medicine.
That is
Science
the
is
art.
one thing, and taking care of people you can do, but if you don't have a connection with the people you're trying to help, they don't trust you as much, and
Yes.
it's important to develop a real trusting relationship with your patients.
That's wonderful. I love to hear that, because you're right. That's what's so important. So give us a little bit of an idea of the types of injuries that you work with or work on.
Sure. We see a variety of conditions. I see mostly patients with knee problems, shoulder problems, hip problems are the most important things that we see. We see them in our office. When we go to the hospital, we see people that have had car accidents or broken bones or things that need to be taken care of urgently. But the combination of the two, taking care of fractures as well as conditions that arise on a day-to-day life, that holds most of what we do. We deal with a lot of patients with chronic arthritis in both the knee, hip, and shoulder. We deal with sports injuries like ACL tears and meniscus tears and rotator cuff tears. And then we deal with fractures. Some patients fall and break a hip, let's say, or fall out of a tree. I just had someone deal with and broke their arm.
No.
So
were they chasing a cat or something?
I think they wanted a coconut. But
oh no.
yeah, but I think the variety of things that we see is pretty broad, but can all come back to that thing that I love about orthopedics, is trying to get people better. So the patients that really come to see us almost exclusively want to go back to the lifestyle that they had, up and walking and playing and doing everything that they are used to doing.
I would say so. And not only that, as you well know, down here in Florida, you must have a really large population that you can work with, because, you know, almost everybody is out. They're either playing golf or they're playing tennis, they're jogging, they're working out. I mean, I work out all the time. So I know that quite a few of my friends ended up with rotator cuff tears because they got, you know, after wear and tear, and then they weren't taking care of themselves either. So
yeah, it's a big problem. My thing is that I want to get people back to doing everything they do. I have not yet told someone that they can't go back to playing golf as soon as we're, done taking care of their problem. I want them back playing tennis and golf, exercising on their own, and leading a healthy lifestyle. I think that's the reason why some patients need surgery, because you can live your life, and you may have pain, you may not have pain, but you want to be able to do everything.
Right.
So that's the goal, is not just to live your life, but to enjoy your life.
I love that. Well, one of my little sayings is, with quality of life, there's quantity of life. And that's exactly what you want to do. You want to maintain, first of all, a really healthy lifestyle. But then if, when you start getting up in your years, it starts to wear out a little bit.
Yeah, absolutely true. That's another condition that we deal with, not just sports injuries, but people that have had arthritic type problems in their knees, hips, or shoulders for years and years, and they come in and say, what can we do about it?
Yeah.
And the old thinking was, you don't deal with an arthritic problem until the end, until you can't bear it anymore. And I think that sort of changed we changed the mentality on it with modern surgical techniques and other injections that we can do. We really treat arthritis as soon as we start to notice it. If you're a patient that comes in and you think you may have some arthritis in your knee, there are things that we can do to try to get you feeling better. Will it be a home run every single time? Not necessarily, but
the majority of the time, though, and that's what's so important. And, what are some of the things then that you do in terms, is it a medicine that you give them? Is it injections? what is it that you do to help them, at least maintain that level of lifestyle for a period of time?
Sure. I'll tell you there's some really simple things that we can do. And I tell this to most patients that have arthritic type problems.
Yeah.
Keeping an active lifestyle is going to be the most important thing. Losing weight, an active lifestyle can really just change the way you deal with arthritis in your joints. Things like oral anti-inflammatories are also an easy thing to do
like the ibuprofens?
Ibuprofens and the naproxens. Those over-the-counter things actually help tremendously. Something you want to speak to your doctor about. Not everyone can take them with the other medications they're on or conditions they have.
Yes, always check with your doctor before taking anything.
Absolutely.
Yes.
But things like physical therapy is one of the things that I prescribe almost across the board, because patients go from doing no activity and they want to get better. So building some strength in your muscles and starting an exercise routine can really lead them down the path of getting better. And all of this we've talked about. I'm a surgeon. We haven't even mentioned surgery yet, right?
Yeah. And that's what I'm fascinated about, because you haven't mentioned anything about surgery. You're talking about prevention.
That's right.
And that's what we need to start with, is prevention. Then, you're normally going to have wear and tear.
Absolutely.
The older that you get, 50s, 60s, 70s, so you're going to have that natural wear and tear. But what I really like is that you've come up with some other alternatives before really having to go in for surgery.
Absolutely. And things like the injection therapies that we now are capable of doing, from simple steroid injections to other different types of lubricant injections to even stem cell or platelet injections. These are all things that I talk about with every patient with arthritis. We've managed to do a pretty good job of holding off knee surgery for patients with arthritis, and really very few of my patients need surgery to deal with their arthritis in their knee, hips, or shoulders. It's a small percentage of the patients, really close to 10 or 20% of my patients, that ever get to the point of needing surgery.
That's excellent. So how did they get a hold of you again? Or you want me to give your telephone number?
Sure, Mo. My phone number for the office is 561-488-8200 and 2200. Sorry about that.
That's okay.
We also have another office that's 561-637-4200. So we get it confused a little bit. Either office will get you in to see me, and we take care of a variety of those patients on every day.
I love that. So just to clarify, the Delray office, you can give them a call there, 561-637-4200, or you can call them at the Boca office, and that's 561-488-2200. So just in case you need to write that down. Yes, excellent. And give him a call. I've got to tell you, it's a wonderful energy that he is emitting, and a compassion and a real caring. And anybody, and this is what's so important, when you go to your doctor, find out whether or not you really do need surgery. I mean, if he's fast and quick and saying, oh, no, we got to go in for surgery, get a second opinion. Call Dr. Michael Krantzow. I got it. Krantzow. Give him a call. You want somebody who's going to give you advice, but in the preventative portion of it, instead of running directly right into surgery. Because that's you don't want to open up the body if you don't have to.
Absolutely.
And so I know quite a few people that have waited and waited and waited to finally get the surgery. And sometimes they wait a little too long.
Yeah, so hopefully...
Talk to us about that a little bit.
Sure. Hopefully you don't need surgery, but there are absolutely cases in which other treatments that we've done, like physical therapy and medications and injections, just aren't working anymore. And what I say is, when it's affecting your lifestyle, that's when we have to talk about it a little further. Be it a knee replacement surgery or an arthroscopy, which is going inside with a camera to do a clean-out procedure. These are all things that we talk about, if it's affecting your daily lifestyle. If you used to walk a mile and now you can only walk a block, that's not an acceptable trade-off for me. We need to get you back walking that mile and
Yes.
keeping as active as possible. We have a lot of new techniques and technology that we use to try to get those patients back to doing everything they're doing.
Oh, excellent. I love to hear that. If you have any questions for Dr. Krantzow, please give us a call here at 888-565-1470. We will take your phone calls on air and answer any kind of questions that you might have. If you happen by chance not to be able to give us a call now, you can also call All County Healthcare at 888-717-7170. Ask for Maddie. She would love to be able to put you in contact with the doctor and or answer any other questions that you might have as well.
Yeah.
Yeah,
Absolutely.
excellent. So let's go into, we've gone into preventative. We've gone into your first phase of taking care of, fixing, as you say, the patient. Let's go into now if they do need surgery.
Sure.
What are they looking at in terms of what's available?
Sure. One of the things that I really like to focus on is some of the newer technology available called robotic surgery. We do a lot of robotic surgery in my practice. That's both for knee replacements as well as for hip replacements. We use a robotic arm to really map the body and help us put the implants in exactly the right position. This is something where millimeters count, and there's nothing that can really quite do it like a robot. I trust my eye, and a lot of orthopedic surgeons have done this for a very long time. But one way we could really improve our ability to get patients well is by putting things exactly where we want them when we're in your body.
Yes.
And that's something that technology that we have available to us, both for hip replacements, so far just for partial knee replacements, and we're working on the technology to bring it to the area for total knee replacements also.
Wow, very cool. Well, tell us a little bit about the partial knee replacement.
Sure.
What exactly are you talking about when it comes to that?
Sure. Well, that's a surgery that we do when patients have arthritis, usually on the inside portion of your knee, but sometimes on the outside portion of your knee. We have it limited. When we have arthritis, we can sometimes have it limited to just one area of the knee. And if that is the case and you've kind of failed all the conservative managements, we have the technology to be able to replace just the arthritic inside portion of your knee or outside portion of your knee without touching the other part of your knee. And that's the goal of that is it's a much smaller operation. The recovery time is usually much quicker. Patients are really out of the hospital within 24 or 48 hours versus staying,
That's
48
amazing.
to 72 hours. So anytime you don't have to be in the hospital, that's usually a good thing.
Absolutely.
And we found that patients are really coming into my office, seeing me at about 2 weeks after surgery without any walker or cane, with a little bit of a limp, but with some physical therapy. They're much better with their pain management and their pain that they had prior to surgery almost immediately.
Oh, that is excellent. Because a lot of times we've heard that they had to be in the hospital for such a long period of time. But I've got to tell you, you don't want to be in the hospital. There's a lot of unsavory things that are going on in the hospital.
There are certainly times when you need to be in the hospital, and that's a very important thing.
Yeah.
But for an elective surgery, we're trying to cut down that time that you need to be in the hospital. I tell my patients, where do you want to be? Do you want to be in a hospital, or do you want to be at home in your bed, living your own life, petting your dog?
Yes.
With your family. That's, in my opinion, the best place to heal.
Well, you're absolutely right. Yeah, because there's nothing like the love of family and dog.
Yeah, a nurse can take care of you, but mom or wife or spouse or significant other, children really do it with love. So that's really the best way.
I totally agree with you. So, do you see some other state-of-the-art interventions that are coming up, or state-of-the-art technology that is starting to come to the forefront?
Sure, there's some. The total knee technology is really something that's very interesting. No one has come out yet for mass publication, has come out with a robotic total knee replacement. So we're working, they're fine-tuning everything, and hopefully by the fall or winter, we're going to have that technology available to us to do total knee replacements using that robotic technology. So that's a really interesting
very
technology.
exciting. Now, will you be the only one to offer that here in South Florida?
I doubt it, but I hope to be one of the first people to do it. I know they're doing some trials with it. And we're hoping to bring it as soon as it's available for everyone to use. I hope to be one of the first ones to do it.
Oh, I'm sure you will be. That's outstanding. So what are some of the other things that we need to do in order to, well, let me go back for a second here. After they come out of rehab, and they're doing the physical therapy, are there other interventions that you use as well for healing?
We use a lot of physical therapy. I think of physical therapy, I have patients that come in that say, oh, I don't like physical therapy. And really, most likely, that's a situation where one of two things happened. You either had poor physical therapy or the patient didn't believe that they were going to get better with physical therapy, so it wasn't going to work. Gotcha. Once we convince patients that physical therapy is going to help them, and we connect them with a physical therapist, which we even have in our office.
Oh, wonderful.
Once we connect them with the right physical therapists and get them in the proper plan, that's the care that they need, and that will get them, in most situations, back to doing everything they want to do.
Well, something, the other thing that I really like about that, with physical therapy, they've got such great exercises. And, you've got a whole diagram of various exercises that you can take with you to the gym and start really working, or just in the house.
Physical therapy is thought of, it's a burden. I don't want to go to physical therapy multiple times a week. The way I think about it is you should be doing exercises every day. If you have back problems or knee problems or shoulder problems, you should be doing the exercises. The physical therapy teaches you what you need to do. Yeah. And once you're done learning what you need to do, you should be doing them at home every day.
Absolutely. Well, just think of it like this, your own private trainer. So you have somebody there that is going to teach you the proper posture and how to maneuver those various exercises. So learn and take heart and do it for yourself then every day. It's incredibly important, and especially as we start to age as well. And I think that's what I was getting to. When we start to age and we've got the wear and tear, what do we need to be aware of? What do we need to be careful of?
Sure. Well, you don't want to overdo it. That's the first thing. You don't want to say, I haven't gone to the gym in 2 years. Let me go for 2 hours and lift heavy weights and go on the treadmill for a 3-mile run. Everything you want to ease into it. You want to make sure you have the approval of your medical team and make sure you're healthy enough to be doing it, but you want to ease into it. The things you want to avoid are just strenuous activity just for the sake of it. I have patients that lift a TV out of the blue because they have to move. No. And while, of course, that stuff's very important, but, if you're living, and you're 80 years old and you're not very active and you go to lift a TV, not a lot of good things can come of that. So you have to use your head and plan and try to prevent these injuries from happening. Sure, I can, and most orthopedic surgeons and medical professionals can help put you back together, but you want to stop it before it gets to that point.
Absolutely, absolutely. So, you make a very good point. Again, if you're going to the physical therapist, take the sheet, because I know that they always have a sheet there for you to follow so that you can do the exercises at home. Well, take that sheet with you to the gym and follow those exercises as a guideline for you as well.
I tell patients that, if you do physical therapy, I prescribe it twice a week. And if you do a month of physical therapy, that's 8 sessions.
Yes.
But if you're at home doing the exercises every day or almost every day, you can get 28 days of physical therapy and see me back, and how much better do you think you would be versus the 8 days?
Absolutely. And feel.
Absolutely.
And exercise is so important because it allows you to feel stronger, and you start pumping that blood through, which means that it's giving you more energy, and you're feeling more youthful and able, more fit to be able to do that lifestyle that you've been accustomed to. So don't get stuck on the chair.
That's the bad thing,
yes.
right?
Or in front of the TV for hours on end.
That's right. Yeah, that can only lead to bad things.
Yes, and I just heard something that had said that being sedentary is now becoming just as bad as if you were smoking cigarettes. And please, by all means, I mean, I'm a big advocate on quitting smoking or never smoking. Very, very important.
Absolutely.
But that's what they were saying, that we've become such a country that just sits, whether it's at work or at home.
I will leave this to the cardiologists and, family practice physicians, internal medicine doctors. They deal with this on a daily basis.
Yes.
You need to do it not just for your joints and bones, but for your overall cardiovascular health and well-being. You need to be up and active.
You got to exercise that hard, kiddo.
You got to get it working.
Yeah, absolutely. Absolutely. Well, it has been an absolute pleasure to have you
Thank
here.
you for having me.
Again, if you have any questions whatsoever for Doctor, you can call him at the Delray office at 561-637-4200 or call him at the Boca office, and that's 561-488-2200. And in case you didn't get that telephone number, you can always call All County Healthcare at 888-717-7170. Ask for Maddie. She can put you in touch with the doctor as well.
Absolutely.
So thank you very much.
Thank you so much for having me.
And we're going to go on a commercial break, and don't you leave. Come on back.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorena Anderson, your life and energy coach, and also your host for this evening. You can find us here Tuesday evenings between the hours of 6 and 7, where we're being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. And I just want to do a little shout out to All County Healthcare for providing this show for all of us so that we can become more informed about the doctors that are available to us for whatever kind of ailments we're dealing with. And it's so important, if it's for you or a loved one, to be able to have the right kind of doctors that are going to listen, that are going to be compassionate, and that are really going to care and spend the time with you. So without any further ado, we welcome you here tonight. We're live on Facebook, All County Healthcare Facebook, and also AMP2 TV. We're streaming live as well. So we have an amazing doctor for you as well. Very, very excited to have him on. And his name is Dr. Rahia. And it is an absolute pleasure. And he's going to teach us something that's very special about gynecology. It's called urogynecology, correct?
Correct.
All right, great. So, welcome. It is wonderful to have you here.
Thank you. It's a pleasure to be here.
I know that you're a very busy man, and so we really do appreciate the time and energy that you've given to us. So tell us a little bit, tell us first of all about yourself and what made you decide to get into this particular specialty.
It's a good question, actually. Looking back, I feel lucky that I chose this field and didn't go into anything else because I absolutely love the field I'm in. The field is a mouthful. It's called urogynecology. Some people refer to it as female urology. The official name for the field is female pelvic medicine and reconstructive surgery. It's a mouthful. It's too long. No one really knows what that means. So people try to approximate what it is that we do. It's a mix of urology. It's a mix of gynecology, a little colorectal surgery, a little sexual dysfunction, and the therapies available for that. So everything kind of comes together with a touch of plastic surgery. So it's a pretty
I love that because, you know, it's broad, but, you know, it covers that whole entire area. So, and that's very, very important because a lot of times you cannot separate out one particular arena versus another area versus another specific area. But to be able to have somebody that is knowledgeable in the whole entire area, the whole pelvic area, is very, very important.
They're absolutely correct in saying that one of the scariest thing any physician can hear is, I have pain in my pelvic area, because whether we are designed or created, however you look at it, all the systems eventually come to our pelvis. So people who have difficulty in the pelvic area could have the issue coming from their urinary system, could be from their reproductive system, could be from the GI system, or the bones and nerves that are going to the area. So unfortunately, for many years, you'd go to your doctor and the doctor says, maybe it's my area, maybe it's urology, maybe it's not, so why don't you go see your gynecologist? And the gynecologist looks at it and says, maybe it's my area, maybe something else, go see someone else. So eventually there was enough of a problem in this area that the leaders of the different fields sat together and they thought maybe it's a better idea to come up with one field that encompasses all those different systems. Of course, we specialize in the soft tissue between the knees and the belly button, but we don't do anything else anywhere else in the body. For example, gynecologists, some of them may be interested in treating high blood pressure for the pregnant patient, or deal with some of the issues that come with the breasts, but we have absolutely no interest in that. We are exclusively dealing with the issues of the bladder, of the issues of the reproductive system, issues of the colorectal area, the pains and the symptoms that patients have in the pelvic region.
So tell us a little bit about where you've had your schooling.
Oh, it's been a long
because I'm saying, you know, you're taking about 4 different specialties and putting them all together, and then you know, so there's a lot of schooling that has to go into that to understand it all.
So you could get into this field by either doing OBGYN and then further subspecialize in FPMRS, the female pelvic medicine reconstructive surgery. You could go do general surgery, then colorectal surgery, then again coming to FPMRS. You could do urology and then come into FPMRS. The field, there are many different ways to get into it, but all of them require 7 or 8 or sometimes more, 9 or 10 years of education to eventually specialize in this field. I ended up, I'm a former resident of Great Neck, New York. I'm an Iranian from Great Neck, for those of the listeners who know where that area is. And I did my undergraduate studies at NYU, and then I went to University of Paris for a little bit.
Wow.
Then I came back to NYU for my medical school. Then I headed over to Pennsylvania, University of Pennsylvania, for my residency. then back to NYU for my fellowship and the subsequent degrees in the research. So I was...
And you finally then made it down here after all that, huh?
After all that, somehow, I've heard that Boca Raton is the sister city for Great Neck. So here I am. And as funny as it is, a lot of my neighbors, a lot of my patients go back and forth between the north and here. And it's an honor to take care of patients who are back and forth from here. And
well, you can
else.
understand it because you know both areas.
That's correct. That's
so
correct.
when they're talking about a great restaurant back in New York, you can you know where that one's at, huh? I love it.
The field itself, as I mentioned, came out of a collaboration between different fields, but there was a little bit of a turf war between the OBGYN side and the urology side. And for many, many years, they did not want to allow this field to develop on its own. The procedures that I do, some of them are as old as 150, 160 years. Some of them are...
You look very young for that age.
all the work that has been done on my face, I guess, is hiding my age. But the procedures are very old. However, the field itself was officially recognized in 2012. So finally,
oh my goodness,
the field
really?
gained its independence from the OBGYN world and the urology world. So now we are our own entity.
Wow.
There are very few doctors, sadly, who are board certified in this field. So somewhere in the order of 1,500 or so internationally, which is a very small number. The conditions we treat impact 50 to 70% of women. And unfortunately, the demand for this field is very high, and there are not too many practitioners who are board certified and fellowship trained in this area.
So tell us how to get a hold of you then.
The easiest way to get a hold of us by calling us. We have an office actually a little bit further up north in Atlantis in Florida, and an office in Coconut Creek, which is not far from here. Both offices have a phone number of 954-570-7644. Again, let me repeat it, 954-570-7644. You can also go to our website. It's F as in Frank, RMIU.com. So FRMIU.com is our website where you can get some information about the different conditions we treat, as well as a little understanding of who each one of us providers are.
That's excellent. And in case you happen to have a question for the doctor this evening, you can call us here at 888-565-1470. He'd love to answer any of questions that you might have. And or if you did not get his telephone number and you do have questions for him after the show, you can call Maddie at All County Healthcare, 888-717-7170, and she'll put you in contact with the doctor. So how long have you been practicing then this particular field?
I moved to Florida about a year ago. Before that, I was in New York, a little bit north of New York in Westchester area. And I was there for about 8 years or so before I came down. So it's been some time since I started practicing this field.
Excellent. And what brought you down?
A good friend of mine who also happens to be a urogynecologist had moved here in 2011. And he started bugging me on and on, trying to convince me to move down to Florida. And I didn't want to initially, but I'm very happy that I finally did as of last year.
Oh, and so are we. It's great to have you here.
It's a pleasure to be here.
Absolutely. So, I know that for a lot of females, as they're aging as well, some of the difficulties that we run into can be incontinence, or it can be urinary tract infections, or it can be the difficulties that we might have with our colon. Can you talk to us about some of that?
Absolutely. Unfortunately, the path of life is full of many puddles on and off. And my field deals with a lot of those.
I like puddles. Very nice for incontinence.
The issue is as we age, we end up having some difficulties in all the systems I had mentioned before. Yes. It doesn't have to be something that would be killing you. It could be impacting your quality of life severely. And quality of life is what my field focuses on. We are not trying to save people from conditions that are detrimental to life, but a life that is constantly interrupted by waking up 5 or 6 times in the middle of the night to go use the bathroom, That eventually leads to loss of memory and many other issues. As we know, sleep is very important for our health.
Absolutely.
So the areas that my field treats, one of them, as you mentioned, is the urinary symptoms. So it could be urinary incontinence, that's loss of urine. Sometimes people get up and they have not enough time to get to the bathroom after they get the warning.
Oh, yeah, frequency.
Frequency, urgency incontinence.
Yes.
Sometimes the issue is people cough or sneeze or do a jump, run, walk, and that causes leakage of urine. Or sometimes the act of just getting up from bed makes people lose urine. We call it stress incontinence. That urinary loss that happens with activity is another area that we treat. Could be a mix and match of different types of urinary leakage. So we call that mixed incontinence. For a very smaller subset of patients than women, of course, the issue of retention becomes an issue because people cannot empty their bladder, and the bladder has a finite capacity. At some point, there's just not enough room for them to hold more urine, so that leads to leakage of urine.
Yes.
We call that the overflow incontinence. Men have more of that with the issue of the prostate. Women don't have the prostate, obviously, but the issues that we treat kind of span both men and women in many cases. Sadly, there is no collaboration between those fields, the colorectal surgery, urology, for men to develop a similar field. Maybe that will happen down the road. But currently, many times I'm giving a talk and the patient's husband or patient's friend stands up and says, I have this problem as well. And I can kind of see why they seem frustrated having been pushed and back and forth between different
absolutely.
practitioners. Another area we deal with is issues with bowel movement. Again, it could be loss of control for bowel movement, loss of control with gas. It would be a very embarrassing scenario where people cannot control it, or in some cases, severe constipation. So again, those could happen because of a myriad of issues, many different medical problems, many anatomical variations in the body that happen. There could be,
and sometimes it's the medicines that they're on, and other times it's the foods that they're eating.
Correct.
Their diet.
Absolutely. And the issues can many times be reversed or kind of improved tremendously if without any type of a surgical management. I am a surgeon, so I love doing surgery, but the majority of patients are helped without surgery with the non-surgical options available to them. So by some modifications in lifestyle, depending on what their condition is, sometimes they can improve.
I love to hear that. And you know, I'm just going to do another shout out for All County Healthcare for providing this our show where we bring on these doctors, because this is the majority of our doctors that we have on, even though they're surgeons, they want to create prevention first. Let's take a look at prevention. What are you doing in your lifestyle? How are you not maintaining some level of healthiness? And, you know, are you exercising? What's your dietary habits? Are you smoking? You know, those are really, and alcohol usage as well. Those are some really major areas there that you have the ability of addressing and cleaning up so that you can start getting your health back. And so I'm thrilled to hear that you also promote prevention first and foremost.
Absolutely. Prevention can be the most important part of our health. Doesn't matter which doctor you see. If prevention is successful, you can avoid a lot of different headaches and a lot of different complications that can happen as a result of the intervention.
Yes.
Another area that my field is interested in treating is pelvic organ prolapse. So as human beings...
Okay, doctor. That's little layman terms here.
So that's the funny part. No one knows about it, but as soon as I mention it, everyone has a friend or family member who has suffered from it. So we are not somehow built to be walking on our 2 feet. So if just think a couple of months back to when Halloween was, think of a pelvic bone, like think of a skeleton that's hanging out in someone's yard, and think of the pelvic bone. And there's the bone up front called the pubic symphysis.
Right.
That bone is supposed to be holding the weight of our pelvic organs, our internal organs. And if you look at dogs, cats, all animals, when they are walking on 4, that bone is all the way in the bottom and holding the weight of all these organs.
Right.
As humans, we got strong, we got smart, however you look at it, and we stood up, and now that bone is up front with a big hole in the bottom of it. And that hole is covered by muscles. Muscles are good for providing some sort of a control short term, but as time goes on, that the muscle recedes and things fail. So
you're absolutely right.
if we were to die when we were 25, 30 years old, no, this wouldn't be a problem, but all of us have passed our expiration
Well, we probably
dates.
have babies at 13 too.
Correct. That would be the issue. And as a result, as the muscle fails, the pelvic organs come down. So in men, you look at the bottom of a gentleman, that's kind of a little sagging down. In women have a vagina in that area,
Yes.
and bladder and rectum can protrude into the vagina and come down. Now, think about, you may have an aunt who had her bladder lifted. That's essentially what we treat. That's the bread and butter of our field. It could be rectal prolapse, it could be bladder prolapse, and patients present with the symptom of heaviness in the pelvis. That's worse as the day goes on, and at night when they sleep, they feel better. Or they say they feel a bulge, they feel something coming through. They cannot empty their bladder. They have a constipation as a result of it.
Wow, that's very interesting. Wow, okay. That's good to know, but you're right. You're absolutely right. And you know, one of the things that I usually talk about all the time is how to do the exercises, especially for your abs, to make them nice and strong, which also adds to making your back nice and strong as well. And then the other thing that I highly recommend are Kegels as well.
Kegel exercises are very good in preventing some of these symptoms to some extent.
Yes.
They're not going to completely make them go away, but hopefully they can slow the progression of these symptoms.
Right.
Now, Arnold Schwarzenegger did not build all those abs by lifting a weight every 5 minutes for every other weekend or so. He actually dedicated time to go to the gym and work out.
Yes.
We cannot expect our Kegel muscles to get strong by doing a Kegel here and there at a red light while watching TV. None of those. You have to dedicate time to it. So Kegels would work if people do at least 50 of them in one sitting, and it has to. You want to get that muscle tired. You don't want to do a couple here and take a couple of hours and do a few more later on.
Exactly. And the other thing that you can do also, instead of, in the beginning, 50 might be really kind of difficult, but do like 15 reps, 3 sets. And start with that. And then after, do it constantly for the 15 and then allow it to rest. And then do another 15. And one of the other things that I say also for that, if you're not quite sure where that's at, when you're sitting on the toilet, when you're going pee, when you're urinating, the specific term.
It's all the same thing.
Well, and stop, tighten up that muscle, stop the flow of urine, and then let it go, and then tighten it up again. Let it go, tighten it up again, and that's how you exercise that particular muscle. And it will help build that muscle, because a lot of times we don't use that.
Absolutely, you're absolutely right. And if you have a difficult time identifying that muscle, you can always ask your providers to confirm that you're contracting the right muscle. But what you mentioned works perfectly. If you can stop the flow of urine with a muscle, that muscle is what you would normally use when you're doing a Kegel exercise.
Right.
Now, another thing that you can do is, once you identify the Kegel muscles, you want to contract them. Every contraction, you want to hold it for at least 10 seconds. Don't hold your breath. You don't have to hold your breath for 10 seconds. Hold the muscle for 10 seconds, and that's good enough to kind of get the muscle the memory that, yes, this is how I can contract. And then doing the repetitions, the 50 of them, at least 50 of them in one sitting.
Yes.
When you get to that level, hopefully after 4 to 6 weeks, we'll make an improvement in the bowel and bladder function.
Absolutely. That's very important.
It's one of the best preventions that you can do for pelvic floor. Now, a lot of these symptoms, unfortunately, are associated with a sense of shame. So no one wants to say, yeah, I just emptied my bladder while having lunch, or yes, what was that show that came back a couple of years ago? Oops, I crapped my pants. I did that when I was at grandma's. No one wants to admit this. So
I know.
Unfortunately, many people kind of negate their symptoms. They don't think about them, or they just never want to talk about it. And then that sense of shame that's associated with them, if they actually brought it up, they'll see how many of their friends and family members would come forward and say, wow, I have the same thing too. So it's like a sisterhood of silence, but no one wants to admit it. These conditions impact 50 to 70% of women by the age of 50, which is a huge number.
Well, they're going through menopause.
From
usually
menopause and
about that.
sometimes even prior to menopause.
Yeah, perimenopausal women as well. Yeah.
Sometimes I have had patients in their 30s and early and late 20s with some of these symptoms. That's when it all starts. So if they can do the prevention at that time, it would help. Many of these patients, once they admit that they have it and they mention it to their family members, it's funny that I have sometimes clusters of someone comes forward, then the sister comes forward, then grandma, then granddaughter, everyone's coming forward. And at that time, it's a lot easier to deal with these symptoms.
Yes.
We also do another area that is related, any type of a sexual dysfunction that could be there, whether it's pain, whether it's loss of sensitivity, all those areas we actually do treat as well. Talk about embarrassing things. People can't talk about their bladder and bowel function. Many people have a harder time bringing up their sexual function with their physicians. And in many cases, the physicians don't know what to do with that information. We are actually the ones who are trained to deal with it. So by all means, bring your issues to us.
That is really, really important. And I'm so glad that you mentioned that, because you're right. You know, you hear all for the men, the Cialis, the Viagra, the various men's clinics for their sexuality. And you hear that, you know, ED problems. You hear that all the time, but you don't hear anything about the women and what they might be going through, whether it's lack of sensitivity, whether or not there's a hooding, you know, on the clitoris that won't allow an orgasm to happen, or sometimes when the labia lips are just way too large, whether it's, you know, because of a birth, you know, defect, or if it's because aging. So, you know, it's so nice to hear that there is somebody out there that's really paying a lot of attention to that, because it's so important.
Even though these are quality of life issues, a lot of different medical insurance companies, as well as the general ones that the federal government provide, a lot of them do recognize these are important areas of life. So many of the procedures that we do are actually covered by the large insurance providers, as well as Medicare and Medicaid. So it's a lot easier to bring this up with your doctor. Does not matter what type of insurance you have. There are many different options that you have in getting the treatments done.
I love to hear that. That's wonderful. And what's so wonderful is that you accept them as well.
Absolutely. We accept every insurance that we come across as much as we can. The only problem is if something new comes up, we have to try to get on the accreditation for that insurance company. That may take a little bit, but we actively try to seek out any insurances out there, because it's not right that patients have these symptoms and are turned away for one reason or another. We want to accept everything that we can to help people out in the process.
I love that. That is wonderful. Is there anything else that you see now that's coming up, any new state-of-the-art technology that you're experiencing, that you're watching coming to the forefront?
This field is, as I mentioned, is a pretty old field, but also a pretty new field. So we have a lot of our instruments that are developed in the surgical world that other surgeons use. Name a couple of them: the Coker clamp, the Alice clamp. These were designed by urogynecologists before they called themselves urogynecologists. So you look at their procedures, they are as old as it gets, 150, 160 years old easily. Then we also are proponents of doing minimally invasive surgery, whether we are doing the surgeries vaginally or using them with the robotic machines. And the robot is not a scary Star Wars thing. It's actually us doing the surgery, but my hands are not small. The robot allows me to have the same dexterity with tiny instruments, except the instrument mimics my hand motion. So if I want to tie a knot or cut something properly with my hand, the machine is much smaller. We can do the same types of surgery without a large incision. We can do them with pinpoint incisions on the abdomen. So that's one of the things that we are doing. We are proponents of doing minimally invasive surgery. Another area that is going to be coming in the near future is treatments with some sort of a stem cell. So the whole concept of our body knows how to deal with ourselves through the stem cells. These are cells that are pre-programmed to heal things, except we don't know how to utilize them. We don't know how to tell them, go and do this thing. So there's a lot of advancement coming up in that area, in us being able to inject some stem cells into, let's say, the bladder wall, and patient who's constantly bothered by their bladder function, we can inject a little stem cell into the bladder, and somehow miraculously they start getting better. Another area it's unbelievable.
It's so exciting.
Another area that is very exciting is pretty much everything in our body is governed by our brain and our nerves. We just don't know how those communications are made. If anyone tries to tell you how the bladder is connected to the brain, well, they can explain it, but most likely they don't know all the details of it. It's just we just don't know anything about it. There are some nerve stimulations that we are learning more and more that if we do those things, somehow the symptoms get better. Something as simple as stimulating a little nerve that goes all the way down to the bottom of the foot improves bladder health. And that makes you think of ancient Chinese medicine with the acupuncture. Probably it's along the same lines where you stimulate one nerve and you get a completely unexpected positive result somewhere else in the body. So stay tuned for some more of those
I've got to tell you, well, you know something, I can't wait to have you come back on again as some of the stuff is coming to the forefront, because it's just so fascinating. And especially for, you know, a lot of us women that are a little older in age, it's so great to know that there is so much that is being explored and so much that's being created to help our quality of life and to be able to live a full, healthy sexual life as well.
Absolutely. Stay tuned for many more exciting things to come by.
I will. So how do they get a hold of you? Where are you located? Please tell our audience.
So we have two offices. One of them is in Atlantis. It's a little bit further north of here, close to West Palm Beach area. And another office we have is in Coconut Creek, just west of Boca Raton. You can call. There's just one phone number to make appointments in both of the offices. It's 954-570-7644. Again, 954-570-7644. Or you can go to our website. It's just open up your internet browser. It's www.f, as in Frank, frmiu.com. Again, www.frmiu.com.
Excellent. Thank you so very much for taking the time, helping educate us, and it's great to know that you're out there. And congratulations, it's great.
Thank you very much. It's a pleasure to be here, and thank you for providing me a chance to express my passion for the field.
I can tell. I can feel it. So if you have any questions whatsoever for the doctor this evening, you can call All County Healthcare at 888-717-7170. Ask for Maddie. She can put you in touch with the doctor. And we look forward to seeing you next week, Tuesday, between the hours of 6 and 7. Until then, have a great evening.